Hey everybody, I am joined here today with Dr. Farina Imtiaz over at Reveal Med Spa. You can find them at houstonreveal.com. And so we're here to talk about their treatments for weight loss, along with some of the common questions that patients have. So doctor, thank you so much for joining us today. Really appreciate it.
You're welcome, Caleb. Glad to be here.
Yeah, absolutely. And yeah, I wanted to start off just by asking about, your experience working with these patients and what got you into this field and being able to help them with this.
Yeah. So I'm a board certified OBGYN. I do practice aesthetic medicine. And as a physician for the last 20 some years, what I kept seeing repeatedly was that there's such an epidemic of obesity, and obesity leads to so many other problems like diabetes and high blood pressure and high cholesterol and depression and on and on and on. I mean, there's really no field in medicine that we can touch without obesity affecting it.
Mhm.
And it's a very difficult subject for both the patients and the physicians because it's an emotional subject. It's got a lot of social connotations to it, and it's very frustrating because there's really no good solution to it. So patients try their very best. Nobody signs up to be sick. Nobody signs up for diabetes. Nobody signs up and says, hey, I'm going to be morbidly obese today.
Mhm.
Patients make choices for a variety of reasons, and they try as best as they can to lose weight, to be able to achieve certain goals. But over the years, it's been very frustrating because there is no good solution.
Mhm.
So, lately we've had a lot of advances in obesity medicine in being able to treat patients who have difficulty losing weight. And we're seeing a lot of patients access healthcare to try to get these medications. And I think that's what we're likely going to be talking about today. But yeah, really exciting time in obesity medicine.
Yeah, absolutely. And I think that's a great point that patients do try, to lose weight and to be healthy, but a lot of times, I mean, there's so much that goes into the marketing for food and everything. It can be
Yeah,
really confusing to know, what's actually healthy and everything. So I think that's a good point.
absolutely. Absolutely. I mean, you would be surprised. I mean, I think most patients think, well, hey, I'm going to work out, I'm going to exercise, I'm going to eat healthy, and part of this eating healthy, maybe something as simple as, I'm going to drink smoothies. Well, it may work for one patient, but unless it's part of a larger diet and change and modification of behavior, things like smoothies can backfire. Just adds extra calories, and people end up losing weight and getting even more frustrated, thinking, hey, I'm doing the best I can, and I'm gaining even more and more weight.
Yeah, definitely. It can almost make you kind of just like throw your hands up in there and not even want to try at all. So I totally get it.
Yeah, most of us, I think, have felt that way.
Yeah, definitely. And so with your practice, what are kind of some of the main things that you focus on to, help patients lose the weight?
Yeah. So, Caleb, first and foremost, in any patient's journey for weight loss has to be a shift in mindset. The patient has to decide to do something different on their own. There's nothing that I know of that's going to do the work for the patient. So the hard work is still theirs. They have to make a commitment to change their diet, and they have to make a commitment to change their lifestyle. And there are medications available to aid above and beyond that. But my first goal with every patient is to educate them about what are some of the things that could be causing weight gain in their diet, how to approach diet in general to be able to achieve sustainable long-term changes in behavior to achieve success in long-term weight loss. So it's easy to lose weight in the short term with a lot of these medications, but what I would like most is for a patient to understand what is it about their diet that caused them to gain the weight to begin with. So perhaps they can do something different in the future so they are not back where they started.
Definitely. And I think that's ultimately what a lot of patients are looking for is really sustained weight loss and being able to keep it off instead of just kind of yo-yoing with their weight.
Absolutely, yeah. And then we do use a variety of medications. There are lots of medications that have been around for a long period of time. Some of them are FDA approved for weight loss. Some of them we use off-label for weight loss. things like phentermine, which is an appetite suppressant, has been around for a long period of time. We use things like Wellbutrin, Saxenda. There are lots of choices for weight loss. And then lately, I've been using a lot of GLP-1 and GIP agonists also to help with weight loss.
Okay, yeah, that's great to hear. And I know a lot of patients are hearing about things like, semaglutide and Wegovy, and those are really kind of like the hot things right now. Can you talk about, how those work and how those are different from some of the different antidepressants, or not antidepressants, the ones that help you appetite suppress.
Appetite suppressant.
Yeah.
Absolutely. Yeah. So, these medications belong to a group of hormones that are called incretin hormones, and they are proteins that bind to different parts of your body, and they trick your body into thinking that you're full. So, in particular, these medications primarily work on GLP-1 receptors that are located in your enteric system. And what they do is they make your stomach feel like it's more full, and just kind of sends a signal back to your brain saying, hey, I've eaten enough, I'm full. And there's another set of neurons that are in the roof of your mouth that connect to your hypothalamus, which is a center in your brain that releases a hormone that also tells your body that you're full. So they stimulate both the stomach and that neuronal pathway in your mouth. And your brain starts releasing a hormone saying, I've had enough to eat. It's okay. We're done eating. Then they work in a second pathway, which works on your pancreas. And pancreas is an organ in your body that releases a hormone called insulin. And insulin works on sugar and helps your body feel full again and lose weight. And these medications work really well. The one that's been around a little bit longer is Ozempic. Ozempic is primarily indicated for treatment of type 2 diabetes. In higher doses, it has been rebranded by this company and marketed under the brand name Wegovy. And Wegovy has been FDA approved for weight loss as well. And in general, we see that these medications help a patient lose 10 to 15% of their body weight. So it's a significant amount. It is something that has to be taken over a long period of time. It does have to be combined with sensible diet, reducing calories, increasing your physical activity. And this is not a short-term solution either. And they are really effective, and patients in general are successful and are happy with these medications. The newer in this group is Mounjaro, which is not just a GLP-1 agonist. It also works on a second hormonal pathway called GIP, which is another hormone that works on your pancreas and helps it release insulin. So it kind of potentiates the effect of just the GLP by itself. And Mounjaro in clinical studies and in clinical practice out there is showing a higher success with weight loss, and patients are more satisfied with that as well.
Okay, yeah, that's really good to know. So you mentioned that this is really kind of a tool in that process, and it's not necessarily that they can just take this and continue the same diet and everything. You do need to make some changes and adjust some things to really get the most out of it.
Absolutely. No, this is not magic. So it always has to start off with the patient's commitment to do something different. They have to make sensible choices. These medications may signal to your brain that you're full, but nobody's gonna be sitting there monitoring what you're eating. And so if you choose to eat cake and say, you know what, I'm just gonna have these potato chips and cake, even though I'm not hungry, and I'm gonna do that for breakfast, lunch, and dinner. And on the weekend, I'm gonna go out and have margaritas and queso. And I'm, hey doc, why am I not losing weight? It does not work like that. So you do have to follow a low calorie diet. Otherwise, just waste of your time and money.
Definitely. I know. I wish that's how it worked. You could just eat, whatever you want with that.
I would like that.
But yeah, we all would.
Caleb, the day we find that drug, we're both going to be really rich.
Yeah, definitely.
Yeah.
And so is there anybody that's specifically not a good fit for one of those medications?
Yes, for sure. So if the patient has any history of thyroid cancer or multiple endocrine neoplasia syndrome, they are not candidates for this. In addition, any patient who has type 1 diabetes. So because these medications work on your pancreas by releasing insulin, um, a patient who has type 1 diabetes doesn't make insulin, so they are not a candidate for this medication. Patients who have a history of pancreatitis or inflammation of their pancreas, it's not an absolute contraindication, but we do have to be really cautious and sensible when we use this medication for these patients. Some other patients that may or may not be a good fit for this, if you may recall, we just talked about that one of the mechanisms is that this medication makes your stomach feel distended and bloated, makes you feel full. So if you have a history of gastroparesis, gastroparesis is a condition where the motility of your stomach slows down, then this may not be a good fit for you because you're going to have further exacerbation of that gastroparesis. Or if a patient has a history of anorexia or other eating disorders, this may not be the right drug because they have to be able to make sensible choices to be able to be healthy and maintain a healthy weight.
Definitely.
If you have a family history of certain endocrine disorders, you may not be a good fit for this either. But otherwise, these are considered fairly safe. And if anything, used in the right patient, it actually has been shown that they decrease the risk of not just diabetes, but also reduce cholesterol, they reduce high blood pressure. They're even been shown to reduce risk of strokes and heart attacks. So really exciting drugs.
Yeah, no kidding. And so if somebody's not a good candidate for that, are they usually able to do something like the phentermine, or do you have other treatments that they can do to still help lose weight?
Absolutely. So patients can always use phentermine, which is just an oral medication that's taken daily. It helps reduce your appetite. There's a medication called Wellbutrin, which I really like to use, and this medication reduces binges and cravings. So often we use it even in patients who are smoking because they find that it reduces your cravings even for cigarettes. Sometimes I'll use naltrexone in patients, which is a substance that helps reduce cravings as well. There are prescription medications that actually combine both Wellbutrin and naltrexone that can be used. So yeah, there are other choices that patients can use for sure.
Okay, yeah, that's good to know. And so, whenever a patient's doing, one of your weight loss treatments, how long do you typically find it takes before they start seeing some of that weight loss?
So it does depend on where the patient starts off with. So if she or he is morbidly obese and they make some serious commitment to lose weight and dramatically change their diet and lifestyle, they may start seeing some effects right away. So you may see some weight loss the first month or so. Average weight loss does end up being about a pound a week. But there are other patients where they may not see weight loss immediately. Usually we do start off with a fairly low dose of these medications just to kind of introduce it to a patient and make sure that they're not having any major side effects. So the first month may not show you a whole lot of weight loss, and that's okay. This is not a sprint, it's a marathon. And so typically 2 to 3 months in, most patients are seeing significant weight loss to where they're starting to feel like, hey, I am doing something positive where it's going to show some effects. So be patient.
Yeah, absolutely. I know as soon as you start on that journey, a lot of times we can feel like we want those results to happen immediately, but I think a lot of us know that's not usually how things work. You do have to work at it over time, but it sounds like the results that you're seeing from it are pretty incredible.
They really are. I've seen some tremendous weight loss. I don't know if I don't think it's typical, but I've had multiple patients who've lost over 50 pounds in 5 or 6 months, which is pretty amazing.
Yeah, no
Um,
kidding.
Yeah.
And so I know we talked about, kind of just those lifestyle changes and things they need to do to really get the most out of it. Is there usually a specific diet you recommend or exercise regimen for them, or is it really just kind of tailored around what's going to work best for them?
It is individualized for sure, but for an average sized woman, on average, a good guesstimate would be approximately 1,200 calories each day. When you are on a diet or even trying to change your lifestyle, so when you're trying to think about, hey, why am I not losing weight? What am I doing wrong? I think it's a really good idea to start tracking your diet. And I love using MyFitnessPal, which is a free app. And everything that goes in your mouth should be logged into that app. So whether you eat something or drink something, even if it's a sip of something you're drinking or a bite of something you're tasting while cooking, it should be logged in.
Mhm.
You want to try to keep your calories below this 1,200 calorie goal daily. And in general, I tell patients they should not drink any calories. So don't drink alcohol, don't drink juice, no sodas, no smoothies, no juice. Try to eat your calories so your brain gets that signal back quicker that you are full. The act of chewing helps potentiate that satiety in your brain. Usually when you're trying to lose weight, doing a heavy duty exercise class, like, going to the gym and just doing something really high intensity may not be necessarily a good idea, because sometimes it can actually make you feel more hungry and can cause further frustration. But definitely you do need to remain active. So weight loss does not come from working out. Working out is for health. Working out is to keep you fit and to reduce risk of heart disease. But working out also is just to keep your muscles moving and to keep you strong.
Mhm.
So cardio in general is a good idea, 45 minutes to an hour each day. Walking, in my opinion, is highly underrated. It's a great physical activity. Go out, take a walk. It's free. I tell people, even if it's raining, it's okay. Put on a raincoat. You're not going to melt. You can dry off when you come back. If it's cold, it's okay. You can put on a sweater. If it's hot, you'll sweat. It's okay. When you come home, take a shower. But there's really no reason why you can't walk. So a lot of times, especially younger women who find it hard to find time in their day to exercise, often will be taking their children to activities. So while their kids are at activities, they can drop the kids off, go take a walk when they're doing their thing.
Mhm.
So if there's any way possible, I'd like patients to find 45 minutes to an hour to get in some exercise. You can always add some weights to that. Body weight activity is really good. Lunges, squats, push-ups, and that helps keep your muscles strong. When you're walking, make sure you get your heart rate up, and make sure it's a brisk walk.
Yeah, absolutely. And it also helps to, basically speed up your metabolism over the whole day, right? It's not just in that time that you're burning off those calories.
Absolutely helps your metabolism. I think the other very important part of it is it helps reduce your stress levels. So the other component to weight gain is cortisol. As a society, we are stressed out. We're always in a rush and we're worried about a million things at once. So it helps bring down that cortisol level. Cortisol, when it's high, makes you gain weight. So it's a win-win.
Yeah, definitely. That's a great point. And in your opinion, when should somebody really seek professional help with, their weight?
Um, I I think anybody who feels like they've tried and they have not succeeded, if you're doing the best you can and you're not seeing results, don't get frustrated. It may just be somebody needs to just point you in the right direction. The journey is still yours, but you may just need somebody to just point it out to you. So it's okay. Come talk to somebody, go talk to your physician, get their input, ask them what you may need to be doing differently to achieve the goals that you're trying to get to.
Definitely. I think that's great advice. And what would be the best way for patients to get in contact with you there if they wanted to come in for a consultation?
We'd love to see anybody who wants our help. The phone number to my office is 281-861-1100. You can find us on HoustonReveal.com.
Perfect. And yeah,
In
those
Cyprus, come on over.
perfect. And yeah, those are the questions that I had for you. Was there any last advice or anything you wanted to leave the patients with if they're struggling with their weight and just not sure what to do?
Um, the one last thing I just want to quickly mention, Caleb, is that patients also need to remember that this is not a medicine that they can stop and revert back to their old lifestyle and think that that things will be different. So this is about changing lifestyle for the rest of your life if you mean to keep the weight off.
Mhm.
And the other thing we're finding is that these medications may need to be continued, possibly for some patients for the rest of their lives,
Mhm.
or at least for the near future. So this is not a quick weight loss journey where you can lose some weight and go to the beach next month. This is really intended for somebody who's looking for a long-term change.
Yeah, definitely. Well, I can appreciate you setting, realistic expectations for them and really wanting them to get the most out of it and make sure that they are happy with the decision that they make.
Absolutely. Well, it's so nice talking to you, Caleb. I hope you have a great rest of your day.
Yeah, you as well. Thank you so much for joining.
Thank you. Take care.